Okay, so pain um, has become part of every evaluation of every patient with surgery. Some people refer to it as the fourth vital sign, kind of to think like you do their TPR, your physical exam. But a lot of clinics are incorporating a pain scale. I'll talk about different ways to do pain scales. I know when an animal comes into VCA ER, we have a pain evaluation sheet and you answer certain questions and an animal will get a pain score and it's part of their evaluation. Now, when we talk about spay and a neuter and things like that, they come in and they're not in pain. Like we don't expect to have a pain score. We haven't done surgery yet. Now, maybe they have another issue like arthritis or something like that. But, if they're coming in for a surgery, we're kind of starting typically with a clean slate. Now, if we're doing hip surgery because they have hip dysplasia, they probably have a level of pain already, and the surgery is going to hopefully relieve that pain. So there's various angles to think about pain, and we have to think about it's really considered an adverse sensory and emotional experience because a lot of animals, eventually what happens is it can result in, that should be learned, not learned avoidance. If you think about your pets at home, and this happened a while ago to my old dog, he like fell down the basement steps, like the house, like long, long time ago. I could not get that dog to go down into the basement ever since then. He associated those steps with an unpleasant experience. AJ, when he learned his chain and he yanked a few times, and now when he runs, he stops and he knows how far the chain goes. Like, so there is sometimes when something like that happens, they learn that this is unpleasant. Now, not a lot of dogs like to go to the vet anyway, but especially if they have a painful experience at the vet and they associate that vet visit with something, then they're going to get this learned avoidance, or like going in the car means I go to the vet means I hurt. So if we can try to make things less painful or treat the pain, hopefully we'll get a better outcome for the patient. And again, sometimes behavior traits, again, are modified just by examples I've showed you. They're not going to do certain things because something was painful. I mean, a baby gate fell on my old dog too. He was weird. And he would not even walk. I didn't even have to put the baby gate up tight. I could just lean it and he would not go by it. I don't think that really hurt him. I think it more scared him. But you'll see your pets sometimes do these similar types of behaviors. So the other thing is the differences in the species. I think about, first of all, if I have a hiding cat, I think all of us, if you have a cat, and I don't have cats anymore, but there were predictable places in my house I could find my cat. I knew you should look in these three places. And if your cat starts to hide, go in the back of a closet or under a piece of furniture, you don't normally find them. These are some things, like these behaviors are changing. And cats don't outwardly really show signs of pain. Now, maybe you pick them up and they growl, but, dogs tend to be a little bit more clingy, a little bit more whiny. And, so an owner is probably going to pick up of signs of pain in their dog well before, they pick up signs in their cat. So, and I also think of when we talk about herd animals, sometimes in a herd, if you have one that's painful, you'll notice the herd avoids that one. They're kind of off by themselves because if they were in the wild, if one is injured, they are prey. And the rest of them are like, we're not hanging out by you because you are, and if this is your herd in your yard and they're not really wild, that's still ingrained behavior that is not going to necessarily change. Like that's just their behavior. So herd animals tend to avoid and cats hide. Dogs tend to be a little more whiny. But I will tell you, with dogs, what's always interesting is within the breeds, there's stoic breeds. And there's dogs that are like, I broke a nail, it's the end of the world. So husky owners out there, but what I've noticed in cattle dogs that came into oncology, and I had this dog that had, the tumor was eating like half its jaw. I mean, I just looked at it and I thought, oh my goodness. But he walked in and he was very stoic. He didn't look depressed. He was still eating dry food. He would actually chew on his leash, which was weird. I mean, there's sometimes, yes. And I mean, and sometimes huskies, God love them. You just go to, like, we would restrain this one to draw blood for chemo and it would scream bloody murder. We hadn't even put the needle in yet. Our little, like, umfufu, like little Shih Tzu or something. So within dogs, there's a lot of range in how they respond to pain based on breed. So they're a little bit different. So the physiology of pain is kind of like what actually happens. And there's a couple different types of pain that we think about. If it's what we call, well, first of all, let me say, nociception is the detection by the nervous system for actual injury or potential injury. I think so. There's like physiologic or adaptive pain is little or no injury with it. They might react. I don't know. Have once you put your hand in a door jamb and you've gotten your fingers stuck and then you get near a door and you're like, you react, you're anticipating there could be pain, even though pain did not occur. You didn't get your hand stuck in the door jamb, but you anticipated, this has happened before, I was close to the door jamb. And that's kind of a, this ouch pain where it can be somewhat that's painful, but not to, or just an avoidance. What we talk really about is pathologic pain. And pathologic pain actually follows a full injury. Now, it can be defined as acute or chronic. But like if a dog comes in with for a spay, that is acute pain. It came in pain-free. We do the surgery. We cause the pain and we cause the injury. Now, chronic pain, chronic pain would be cancer pain, arthritis, maybe an old injury, and the muscles are sensitive in that area. So this could be an interesting recording. I don't know why I have the hiccups. So let's say
St. Patty's Day. Have you been drinking already?
I know. This is coffee. I swear. This is she called me on it, man. No, I swear. I wish. Is that coffee? Oh, look at you. Well, you're muted. Are you?
Yeah, one of my soccer moms made this for me. It says this might be Bailey's.
Oh,
it might be.
It might.
You don't know, do you?
I don't know. This might be coffee. It doesn't say that, but this is coffee. I really want to chug it, and it's hella hot right now, so trying not to sear my esophagus and wake up at the same time. Okay, so, and the mechanism of pain, when we talk about pathologic pain, which can be acute or chronic, it can be based on inflammation. Arthritis causes inflammation, and inflammation causes pain. So arthritis is a form of inflammatory pain. Anytime there's inflammation and swelling, there's pain. It can be neuropathic. Now, this can come after a nerve injury, neuro meaning nerve, but also if you've ever heard of phantom pain. Sometimes dogs, we do an amputation. And sometimes dogs will kind of chew at or potentially mutilate the area, and the limb is gone. And normally a limb amputation takes away the source of pain, because usually we do amputations if there's cancer in the leg or if there's a really, really bad fracture that's not repairable. So those are a couple reasons you would do a limb amputation. But sometimes the dog fixates on that area, and it's even mentioned in human literature, is people sometimes feel like the amputated area, there, like something is still there. And that's kind of a neuropathic kind of pain. Cancer, obviously, and if it's idiopathic, that means we don't know. An animal can seem painful and we can't pinpoint the reason. Occasionally that does happen where they just seem painful and we just, anytime you see the word idiopathic, it just means we're not really sure. Like idiopathic seizures, animals have idiopathic seizures, meaning they have seizures, but it's not from a brain tumor, it's not from a toxin. We can't find anything physically wrong with them. Blood work is normal, and once you rule out common causes, then we call it idiopathic, which sometimes happens on a fair amount of basis. You can classify it visceral or somatic. Remember, visceral is pertaining to organ. Somatic is pertaining to like more of the peripheral tissues like muscle and skin and bones. So when we're talking about visceral versus somatic, when I get into drugs, some drugs are better for deep or visceral pain, and some are better for somatic pain, which is considered more of a maybe not as painful. And then, we can classify mild, moderate, or severe levels of pain. I do need you to know the steps to the pain pathway. So what happens after an injury, this could be like making a surgical incision. Basically, there's going to be a stimuli. And if you remember from anatomy, I know it was ages ago for you guys, but when we talked about a neuron, it has to create an action potential to send the signal to, and then that's basically how the signal goes from that neuron to the brain. Once the action potential is created, the neuron flips its charge, sends a signal, then it's transmitted or transmission, excuse me, to the spinal cord. And then once it goes to the spinal cord, it can be modulated. The spinal cord can decide, are we going to amp up this signal or modify it? Do you remember a minute ago when I said sometimes you put your hand by something, or think about like you touch a stove and you're like, is it hot? And you kind of are like, and then, you don't jerk your hand back like it's hot. You might like, oh, okay, it's fine. That signal has been modified. You didn't do like a full pull your arm back. You kind of, just pulled it back a little. So the spinal cord can either amplify or, kind of suppress the signal to a certain degree. And then once it gets to the brain, then it's going to have perception. Now, what are we going to do about it? The brain is going to process it, and then the brain is going to create the appropriate response. Now, I will tell you, for example, when we use lidocaine, and I talk about, local blocks coming up, lidocaine blocks transduction. What lidocaine does, if you remember, along the neuron, there was the sodium-potassium channels, and basically the sodium channels open, sodium rushes in, changes the polarity, gives it a positive charge, creates an action potential. Lidocaine prevents sodium channels from opening. So therefore, you can never form an action potential. So does the signal ever reach the brain if we can't even create an action potential? No, and that's why you go to the dentist and they put, you don't react, you don't feel it, because technically the pain is happening, but because the drug they gave you blocked transduction, it never gets to the spinal cord and the brain never recognizes that something hurt. And that's why you're numb. And so I'm going to talk about some of these different drugs. Where do they work in this pathway? Where are they actually? And that becomes important because when we give different drugs, and this is the goal of pain management, is that each step of that pathway has different receptors associated with it. When we give drugs, they can target different receptors at those different steps. Like I just told you, lidocaine works at the neuron and it blocks those sodium channels. So therefore, lidocaine works at the first step. Opioids, those receptors are found near the spinal cord. And so, if it works at the spinal cord, we are trying to change transmission or modulation. So it's working at this step. So again, different drugs are going to work in different steps. But the whole goal that I want you to know is multimodal therapy. Pain management is going to be best if we use a few different categories of drugs. And especially because you guys are close to externship, believe it or not, I like to give you like a clinical tip. Owners are sometimes very worried about taking home multiple. I had this lady and we were sending home Rimadyl, gabapentin, and tramadol, which is kind of our common three. Most of our post-op big surgeries get those three drugs. And she's like, I don't want to drug up my dog. I don't want to give him all these drugs. I mean, and people, because of opioid abuse, and people are very cognizant of not taking too many drugs because we don't want to form dependencies. We don't deal with that in animals. But I had to explain to her, I'm like, well, this one is for inflammation. This one is to calm the nerves. And this one is it's like an opioid type drug, and it's going to give feelings of euphoria. These three drugs are not doing the same exact thing. Multimodal. There are three drugs that are working at three different aspects of the pain pathway. And I finally convinced her to take these drugs home and give them to her dog. So I'm like, I'm not trying to make your dog a druggie. That's not what happens here. That's not how animals react to pain management. But you have to trust us that your dog is quite painful, and we don't want them feeling crummy. We want them feeling good. But again, a dog is going to be, instead of just sending a dog home with tramadol, one drug, we know that this dog is experiencing pain via different ways. So by three drugs, we are treating at different pain pathways. Now, does every patient, a lot of neuters go home with just Rimadyl, but if a dog had like 10 extractions, that dog's going to hurt. That dog needs probably a little bit more than just a straight up neuter, so you have to look at the case, and you have to look at the type of pain. Also, that patient, you'll know if they're if it's Alicia's husky, we better like load it up on pain meds or something. Some dogs you just know, you're like, they're going to be a drama queen, but we want them to feel good. So multimodal therapy is key. And the problem is if we do not treat pain. Now, some of this stuff is not happening the next day, like catabolism and wasting. Eventually, physiologically, when there's pain, they are in a persistent sympathetic state. And we're kind of burning through stores. If you're constantly feeling pain, and we're kind of like, not that the animal's always acting fight or flight, but their system is going to be burning through their stores. And eventually there can be some catabolism, is where they lose body weight or body mass, and some wasting away. Now, I will notice if you have a dog that has had hip dysplasia its whole life, sometimes when you look at them, one side of their hip doesn't look as built up as the other. Now, sometimes they lose muscle because they're not using that leg like they're using the other. Sometimes dogs are really good. The owner doesn't notice a limp, but a dog may be favoring one limb over the other. And if they don't use that limb, again, over time, you can feel one leg, again, is just not as muscled as the other leg. So part of that's the wasting, part of that's use of the limb. That the dog is shifting weight to the good limb, therefore the bad limb isn't getting as much use. Immunosuppression, because again, when they're in this persistent painful state, it's using resources, and the immune system is part of that. And so they are maybe prone to other infections because their immune system is being taxed. And then the big thing here is inflammation and delayed wound healing. So after surgery, a lot of times we'll put them on drugs like Rimadyl, which are anti-inflammatory, but they don't completely suppress. You need some inflammation to actually have surgical healing. Sorry, I have to take. No, what's wrong with my voice this morning? You do need some inflammation, but we don't want it. We don't want persistent inflammation. So they will usually be put on some type of anti-inflammatory. Most of the time, the non-steroidals. Prednisone is a little too powerful. You'll definitely get delayed wound healing. One thing, of course, since this is anesthesia, obviously they're going to be at a higher, if they're painful, they're going to be at a higher anesthetic risk because they're going to need higher dosing. And again, one of the things I told you, the reasons for pre-meds is anesthetic sparing, using lower doses of propofol, lower doses of isoflurane. And if they are, the more painful they are, we may have to use more drugs. We may have to particularly use higher doses. And obviously we don't want them to suffer down the road and not, feel well when they go home. Let me talk about what we mean by primary hyper. So analgesia is pain. That's why analgesia is without pain. An is without, and analgesia is pain. So if I have an animal that has hyperalgesia, they're in a heightened state of pain. But there's primary and there's secondary. So when an animal first feels pain, like when we do surgery and they are, first having pain, or when the injury starts, they get what's called peripheral hypersensitivity. So the nerves so say they have a laceration to their right forelimb, and the nerves here are firing. And so sometimes that whole limb is going to be like, you could just touch up here and they might react. Like you're not touching the wound, but the area peripherally is hypersensitive because the nerves are firing. And this tends to be near the site. And this can happen from a non-noxious stimulus. Noxious is an annoying or painful stimulus that can cause injury. So a non-noxious stimulus could be like petting a dog, feeling its ear, putting a stethoscope on their chest. Those are things that are not painful, that don't cause, those are non-noxious. It's a stimulus because you're touching them, you're doing something, but it's not going to cause injury or pain. It's non-noxious. But a dog could react to it because they're in a heightened state. They're hyperalgesic because we've not treated the pain. Eventually, if you let that go and you continue to not treat their pain, then you get what's called a secondary hyperalgesia. And what happens here is that this has been firing so much. Now, when it fires, it's sending signals to the spinal cord and the brain. Then what happens is the central nervous system gets overloaded with stimulus. Because there's so much firing, you get a secondary hyperalgesia. Now, this could be like, the dog has an injury here, and you go to pet their butt and they react. Well, that's far away from their right forelimb, but because the whole body is in this heightened state of hyperalgesia, they just react anywhere. You just can't, you touch them and they just react. So they're in this secondary hyperalgesia. This is called wind up, and that's what I want you to know, because everybody talks about wind up. The goal of pre-meds and the goal of treating pain is to prevent wind up. We don't want them to get to that stage. Now, if you have a dog that's hit by a car and they broke a leg and it's been an hour and the dog comes in, more than likely they're going to be getting into wind up. They're going to come to you injured. In those situations, like in an ER, you don't have, you've been presented a painful animal, but I can tell you, one thing that we do to an animal that has wind up is we give them usually a pretty high loading dose of pain meds. And remember, a loading dose is a higher dose to try and reach plasma levels quicker. So if I give an animal a loading dose of hydro, it's a pretty high dose, And then hopefully the other doses can be lowered, and then those are maintenance. Then a maintenance dose is to maintain that drug in a plasma level. But sometimes you got to get them. Yeah. So my whole point is, let's take a dog like a spay, a neuter, a dental. They come in and we've not done anything to them. So by pre-medding them, we're going to hopefully prevent windup. If we give them a good pre-med of pain medication, and then we continue that post-op and we send the owner home, we're hopefully going to maintain adequate pain management without getting to windup. You don't want to get to windup. So that's the goal, and that's where they're just hurting and they react sometimes wherever you touch them. The problem is there's constant stimulation of the spinal cord. It's like overdrive. And the spinal cord's like, dude, I can't, like, you're just sending me too many signals. And then all the neurons become hyperexcitable, and they are like I said, you might put a stethoscope on this dog and he might freak out because he's like, somebody touched me. Because the neurons are just, and you're like, it's a stethoscope. It's okay. So you just have to be cautious. Hopefully good pre-meds, that's the goal. Prevent windup, prevent these hyperexcitable neurons from ever becoming a problem. Now, whenever I've talked about what happens behaviorally to the animal, what you might see if they're painful, but you have to think about what's happening physiologically. I can't see physiologically what's going on. I can just know, and this is where remembering your anatomy comes into play, but neuroendocrine changes because, remember, your neuroendocrine system, your nerves and your endocrine system are what sends signals, hormones and neurotransmitters. They transmit signals, they transmit information. When they are in a heightened state of activity, then this is what can break down, we get in this catabolism. ACTH, adrenocorticotropic hormone, ACTH, and that actually is released from the pituitary. It goes to the adrenal gland, and it causes the adrenal gland to release cortisol. If you remember, cortisol is the primary hormone of stress. When an animal is stressed, they release cortisol. Cortisol causes hyperglycemia, raises blood pressure, increases heart rate, and epinephrine as well. Now, when you boost this blood sugar, the problem is we also get a decreased insulin. But the problem is now we're kind of hyperglycemic. So we're kind of setting up this stress state. The animal is in stress. The other thing is these hormones all here can cause the sympathetic stimulation. And what does sympathetic stimulation does? Well, number one, it causes vasoconstriction. Sympathetic stimulation vasoconstricts your vessels to send blood to your heart, brain, and your muscles. The problem is there's other organs like your smooth muscle organs that aren't getting that blood flow. So now we're setting up, then you're telling the heart to beat faster. Myo is the muscle of the heart, the myocardium. So when I say increased myocardial work, if the heart is beating faster, it's working harder. And then when that is a muscle, anytime you make a muscle work harder, it needs oxygen. It needs more oxygen. So you increase myocardial oxygen consumption. This is the pathway of physiology of what happens when an animal is in stress or in pain. And this is where we can see the cardiac arrhythmias. So most cardiac arrhythmias come from an electrical disturbance in the heart. That's what a cardiac arrhythmia is. And when you get an electrical disturbance in the heart, sometimes the heart does not beat normally. So the consequence of an arrhythmia is that you have impaired circulation because the heart isn't pumping the way it should be. So this is like, you have to follow the breadcrumbs. What happens if this happens? And when the heart muscle is deprived of oxygen, now hopefully in a normal animal, they're getting oxygen just fine and their heart's pumping hard and it's getting the oxygen it needs. That doesn't happen to every animal. Sometimes they're not breathing well. Sometimes they're respiratory depressed, hello, under anesthesia. And when you make something work harder, yet they're not getting enough oxygen, then potentially we set up this problem. And that's what I'm worried about. And anytime the heart muscle can get starved of oxygen, we potentially get into cardiac arrhythmias. Now, the other thing is that the pain typically creates this stress response. And that's what I was just talking about with ACTH and cortisol. When an animal is stressed with fight and flight, it puts them in that situation. And again, what happens in fight and flight? You get we talk about bronchoconstriction, vasoconstriction, increased heart rate, increased blood pressure. All of those are fine if they happen for a moment of stress. But the problem is if they're in persistent pain and they're in that persistent, remember, sympathetic stimulation gets them through a little stressful event and they come out of it. They shouldn't remain in fight and flight. And that's the thing with pain that we're trying to prevent, is to being in this persistent fight and flight or sympathetic stimulation. And sometimes they say, and this is a word, anthropomorphous, avoid projecting human emotions onto the animal. Oh, but I'm going to tell you, as I point to my guys back here, you can't help but look at an animal and go, oh my God, if that was my leg, or if that was my mouth, or if that was, if this happened to me, and in my opinion, it's okay to do that for a reason, because you're taking the pain seriously. You're like, if this happened to me, I would want this. But again, you have to also look at it objectively and treat the pain appropriately. And that's what we're going to and kind of talk about. And the whole goal that I've been saying since week 1 of anesthesia or getting into drugs is preemptive analgesia. And that's administration of pain medication before the painful event occurs. Again, I said, if you knew you were getting a headache at 4:00 and you could take Advil at 3:30, how awesome would that be? Right? I mean, so we know we're going to spay a dog and we're going to cut open its abdomen and take out its uterus. That's probably going to hurt. So maybe we should give him some pain meds. Because the old thinking, there was an old, and if any of you go to work, I'm not slamming older vets, okay? Because, so everybody's protective of Dr. Pole, or you got that grandpa vet that's been in your town for 100 years or whatever. That's all fine and dandy. But the old pain management thinking was, let's see if they're painful. Let's wait till they're painful. The problem is you did surgery. Surgery causes pain. Animals show it differently. I mean, if you spay a cattle dog and you spay a husky, they had the same surgery. The husky's probably going to act different than the cattle dog, except you did the exact same thing. So I'm not waiting. I shouldn't be waiting for a behavioral response to treat that animal's pain. I should just know we did something painful. We need to treat it. And it is proven you can use lower dosages if you give them a pre-med before the pain starts. If you can give them hydro a half an hour or an hour before surgery, the doses of hydro you're going to use after are going to be lower. And anytime you use a drug in a lower dose, you get less side effects. If you have to give this dog a whopping dose of hydro can cause vomiting, panting, sound sensitivity, potentially hypotension if they have a reaction. There are side effects to these drugs. So, anytime you have to go high on a dose, and you may have to, but if you would have just given them something before the pain started, you probably wouldn't be in that scenario. So let me stop at preemptive analgesia. Do you have any questions? Okay.
I have another